Good morning, members. Thank you for being here this morning for the Joint Committee on Education. We'll go to item B on your agenda, an overview of recent legislative action related to state public school employee life and health insurance program. Ms. Thayer, identify yourself for the record, and we look forward to your presentation.
Thank you, Mr. Chair. Jill Thayer, Bureau of Legislative Research. So I'm going to be brief. I was asked to just provide you with a little bit of background on the recent changes to PSE funding and give some context to the next presentations that you're going to hear from Patrick Klein with the Siegel Group and Grant Wallace, who is the EBD Director. Since about 2013, at least, that I'm aware of, the General Assembly has been working to achieve solvency in the state and public school life and health insurance program, which is a mouthful, so I'm just going to call it the program going forward. That program includes the public school employee health insurance plan and the state employee health insurance plan. And so today you're going to be hearing about funding for the PSE, or public school employee health insurance plan. In 2021, after years of financial issues with that plan and the legislature needing to make large transfers of money into the plan due to the solvency issues, you all, the General Assembly, took some action. You abolished the EBD board and transferred all of its powers to the Board of Finance. And at the same time, the Executive Subcommittee of the Legislative Council began a study of the program to see how you could find long-term measures to solve the issues that were happening. And they had the goals of making that program actuarially sound, providing reasonably priced benefits to the members of both the ASE and PSE plan, and providing for legislative oversight for the program. The Executive Subcommittee hired the Siegel Group as consultants to assist them with that study. And since then, we've continued to contract with the Siegel Group to provide actuarial analysis for the legislature, including what you're going to hear today from Patrick, who will talk to you about PSE funding. The study and recommendations of the Executive Subcommittee resulted in 8 acts being adopted during the 2022 fiscal session. And I'm just going to highlight 3 of those for you today because they will pertain to what you're going to hear from Patrick and Grant in just a few minutes. Act 113 created the legislative oversight that the General Assembly wanted for the program. It requires that all Board of Finance decisions related to the program come to the Legislative Council for approval, and also created the EBD subcommittee of the Legislative Council, and I know some of you are members of that subcommittee. Act 111 deals with funding of the PSE plan specifically. It stated there that it is the responsibility of you all as the House and Senate Education Committees through your adequacy review process, to determine the amounts that will be provided to EBD for the PSE plan through both school district funding on a per month per participating employee amount, and by DESE, the Department of Elementary and Secondary Education. Act 108 established a mandatory reserve balance for the ASE and PSE plans. It set an optimal reserve balance at 14%, and then created guardrails in that reserve fund of a low end and a high end of 12% and 16%. And once the fund reaches either one of those, it set up triggers for action that can be taken by the EBD director, which has to be approved by the legislature, by the Legislative Council. So you're going to hear about both of those things from Patrick and Grant in just a moment. I hope that this provides some context to what you're about to hear. I would be happy to answer any questions, but if it's to do with PSE funding, I'm going to defer to the experts that are coming up after me. Thank you, Mr. Chair.
Thank you, Jill. Members, any questions regarding specifics to legislative acts that have brought us to this point? Seeing none, then, Jill, thank you very much. We'll go to item C. If we could have Mr. Wallace, Mr. Klein. Good morning, gentlemen. If you'll identify yourself for the record and then begin your presentation. Thank you.
And Patrick Klein, I'm an actuary with Siegel.
Grant Wallace, Director of the Employee Benefits Division.
All right, so I've been asked to look at the adequacy of the PSE funding. This is the second time we've done this. We did this back in 2022. We're in a similar position to where we were before. There's a few things that have changed, but we're still in a very strong position financially. Just to level set, there's three sources of revenue that help fund the plan. You've got the employee contributions, you've got a district contribution, and that's kind of determined by a minimum district contribution, a dollar monthly amount, and they can contribute more than that. And lastly, there's a Department of Education subsidy or an amount that gets paid, and typically that's just a flat dollar. So the minimum district contribution has recently decreased from $300 to $234.50, so that's where it stands today. The employee contributions, there's a plan, a 5-year plan, I believe, to strategically get the contributions more competitive with benchmark states. So those contributions are actually decreasing some or staying relatively flat, and that's part of the plan. And then the Department of Education fund, I believe that's $142 million. So all three pieces are proportional right now. They're all about the same, and that's what helps fund the plan. So we're projecting the fund to close 2024 with $265.7 million in assets, which is a lot because the target reserve is only 64, and that target reserve is calculated as 14% of the projected expenses for the given year. So we're in a position where there's a sizable surplus. Part of the reasons why we've built this surplus is COVID in 2020, we had people not seeing the doctor, they were delaying services. Some of that came back, but there was still a gain across the country on medical spend. There was one-time money from ARPA and the restricted reserve. So all those things have kind of helped build that surplus. So where we're at right now, we're still projecting a slight gain in 2024, but if we do nothing to the funding, the expenses are going to overtake the revenue, so we're going to start seeing a loss in 2025 and beyond. And then some of the information that we worked from, Grant and EBD provided information on the school district participation and their contribution levels. We also got information, projections from Milliman that we helped use in our numbers because they're closer to all the claims and enrollment. We validated it for reasonableness. The only real change to the Milliman numbers was they weren't including an impact to the Navitas rebates yet. So that's the PBM change that happened 7/1 of this year. So that's in the other line. We'll go over it soon, but we have an increase in the rebates, so that's helping with the fund balance. And then what we're going to do is go over various funding scenarios just to show you the impact on if you increase this, if you leave things flat, how does the reserve get impacted over multiple years. And I think the big takeaway is that you're in a very strong spot financially, but you have to be strategic on how you spend down the surplus. And eventually you want to incorporate medical CPI at all three levels of funding, and then your revenue can maintain the same level of increase as your plan expenses, so we won't have this roller coaster that I feel like the fund's been on for several years now. So any questions about just the introduction?
Senator Hammer, is this regarding his first part of his introduction? Okay, certainly. Pat, if you want to go ahead.
Okay. So this chart or table is going to be the format for the next several slides. I just want to get everyone acclimated. What we're showing here are calendar year numbers. The numbers below district contribution, employee funding, all those numbers, those are in millions. The numbers above that are shaded gray, those are the assumed minimum district contribution amount. So that's a monthly dollar amount. So $234.50 is where we stand today. We've assumed that that amount changes on a fiscal year basis. So July, I believe that's the way things have changed historically. I think there's some latitude to increase that on a calendar year basis instead. But for this presentation, we assumed a fiscal year change. So to make things a little easier, we converted in the next row that minimum district contribution to calendar year. So basically taking an average of 6 months, the first 6 months and the last 6 months to show that on a calendar year basis. So this is the baseline scenario. This is if there's no changes to funding whatsoever. And again, the top section, we have our revenue streams, district contributions, employee funding, Department of Ed funding, and other, which is mostly made up of pharmacy rebates. So those total in 2024, $460 million. On the expense side, down below, we have our medical claims, pharmacy claims, admin fees, plan administration, and the Medicare Advantage premium cost. And those total up to $455 million roughly. So in 2024, we're projecting a net income or a gain to the assets of around $6 million. So that'll close the year with $265 million in assets, well above the target reserve on the last row. So as we move out to 25, 26, 27, the trajectory of the fund starts to decrease. So we can see that net income go from 20 million to 51 million, $86 million loss. And we remain, even in 2027, you'll see that we still have assets that exceed the target reserve. It's pretty close, 107 versus 80. But again, the trajectory of the fund is we have a negative loss. We have a big disconnect between our expenses and our revenue. And that just continues to snowball as the funding stays fixed and the expenses trend up. So in 2028, you can see there's a $124 million loss, and that would mean the assets in the fund go negative $17 million. So obviously not a scenario that we hope plays out, but I feel like the plan has been in this position before where there's been a surplus of money and the strategy has been to do nothing because we didn't really need to. And then you'd get to 3 years down the road. Not only do you have an issue where your assets are below your target reserve, but you also have to increase your revenue enough to offset the expenses to neutralize that gain loss. And I think the solution for the most part has been putting one-time money into the fund. So yeah, that helps build your assets up, and it may make you more solvent for a year or two, but it really doesn't solve the issue that you have this disconnect between your expenses and your funding. So that's what we're trying to plan for over the next couple slides. Any questions on the baseline? So again, a part of our strategy has been once we get the expenses and the revenue on the same basis, that we want to increase the revenue at a medical CPI that aligns with the plan expenses. So here, what we're showing is if we start right now in 2025, fiscal year 2025, and increase this minimum district contribution, that's the only lever that we're pulling here. If we increase that at medical CPI of 3.7%, how does that impact our numbers? So We're in better shape than we were on the last slide, but we still have this loss that continues to grow out to 2028. So increasing the 234.50 minimum district contribution with a medical CPI is not going to be enough to remain solvent. In 2028, you'll see that the assets drop to $51 million, so that's below our target. So this scenario shows if we increase two levers of funding, so the minimum district contribution increases with that 3.7%, but we also increase the Department of Education funding, so that $142 million that's received into the fund. If we index both those numbers at 3.7%, that again helps build more income and it neutralizes some of those expenses. But again, it's not enough. So when we go out to 2028, we have a $76 million loss that we're facing. The target assets are above the target reserve, but if we projected this out a year or two more and there was nothing done in addition to the medical CPI, the fund would go negative. So then we looked at two potential solutions on what to do to get the plan where it needs to be. And both have pros and both have some cons, in my opinion. So this would be a steady approach to increasing the funding. We would still leave district or the employee contributions the same, but we would increase the district contribution and the Department of Ed funding at a higher percentage, so 8.8% is what we solve for. And we spread it out over 10 years. So you can see that your assets actually grow in the first couple of years. We have a slight gain in the projections, and then we have a loss. And in the last year of 2034, our assets are at $175 million. Our target's $141. So they're in the same neighborhood of where we want to be. We still have a loss of $48 million in that last year to overcome, but this assumes all the expenses hit the projections exactly as trend. There's no plan design changes. There's no RFPs that save money. So there's all different ways that the plan can manage these costs to help mitigate trend in some ways. So, this is probably a more conservative approach. You're going to be solvent and you're going to have a sizable surplus for the next 5 years, and then things will slowly glide down to where you need to be. I'd say the biggest negative with this is that you're sitting on a massive surplus and you're increasing the funding that's coming into the plan. So that may not be something that is attractive. Then the last scenario that we ran shows a one-time adjustment to the minimum district contribution to help align your revenue and expenses. So in 24, 25, 26, we actually do nothing to the funding. We leave it flat, and that's going to help accelerate our assets decreasing, so we kind of buy this asset or our surplus down as quickly as possible. And then starting in 2027, we're going to increase our funding levers up to $365 on the minimum district contribution. So it's really a one-time step to get those revenue and expenses in line. And I like the outcome here in 2028. So we have assets that are above our reserve target slightly, but our gain loss is manageable. It's $22 million. So that's approach if we want to spend it down quickly and then bump it up with a one-time adjustment to get things on a level playing field. So any questions about any of the scenarios or where things stand?
Senator Hammer, you ready? You're recognized.
Thank you, Mr. Chair. And I know in other meetings, y'all have made presentations. I want to just hit on a couple of things. On page 5, where it's assumptions and caveats, the assumptions are the projections, included medical claims, pharmacy claims, rebates, et cetera. If you had to put these in order as far as what's contributing the most drivers to the increases, which ones, how would you put those in order?
The medical claims is the biggest if you look at the different expense line items. Oops. So you can see here, the medical claims, $311 million. Your pharmacy claims are $97 million. So even though the trend on the pharmacy claims is a little bit higher, that 8% versus 6%, there's a higher volume or higher baseline in your medical claims. Medical claims are typically 75% of the total spend. So that's, the biggest driver here.
Okay, and then if medical claims are the biggest, and you said 75%, correct?
Roughly.
Roughly, okay. The way we're going about dealing with our population when it comes to what adds to the medical claims, the way we see the doctor, the way we don't see the doctor. We have discussions about wellness visits and all those other things. What do you recommend as far as what other states are doing that we're not doing in order to bring those medical claims down? And does the medical claims include the percentage that we pay our, I'll call third-party administrator, I guess Blue Cross Blue Shield? Does it include the percentage that we pay them for administrative costs?
So so those are strictly claims. The third line here in the expense section shows the administrative fees. So that would be what is paid to the various vendors.
What page are you on, please? When you say that?
I'm on slide 6. I'm not sure what page that translates to. Yeah, really on any of the tables or charts.
Okay, so let's just take the administration fees. In 24, it goes from 34.6, you project out, if I'm on the right line, in 2034, they're up to 52.9. What's the rationalization as to why those administration fees should increase at the rate that they are over that period of time? If utilization is the same, if population is the same, what's the justification for that administration rate going that high?
So it's twofold. Part of this whole projection, and we have this as an assumption or caveat, is that there's an assumed increase in the population. So you do have enrollment increases. So that plays into all these fees are on a PMPM or a per employee per month or PMPM per member per month. So if you have more people in your program, you're just going to pay a higher dollar amount, even though the rate may stay the same. You're going to pay more dollars to the vendor. There also is an assumed inflationary assumption on the increase to the fixed fee itself. And I believe that's around 2.5%.
All right, I'll go with the queue. Thanks, Mr. Chairman.
Representative Beck, you're recognized.
All right. Thank you, Mr. Chair. So, good work. It looks like you've done a lot of work on this. I have a question concerning, it seems like we're saying that there's going to be we're trying to make these adjustments as we go to get rid of the surplus. And I like the idea. I actually liked your last one the best because you get rid of that surplus. There's no need having that money sitting around. So anyway, I like that concept. But the thing that none of your models project is anything that's tied, and increases that are tied to a percentage of maybe corresponding increases that you're projecting in the expenses. It seems like that would be a better way to actually do this. So in other words, you would say, okay, we're going to increase, this is how we're going to, I'm just using this example, this is how we're going to distribute the increased cost. the department's going to pick up 2%, well, whatever, the percentage of each group, and then tie that directly, the increases, tie those directly to the increases in the total expenses
Right.
for the plan. So that way, the plan would almost be self-writing itself all the time. And I just curious as to why we didn't do a model like that.
That's a great point. And actually in this last scenario, I probably didn't cover it very well, but there is a one-time adjustment. But then this last part of the sentence says, and increases with 5% annually afterwards. So really if you look at the expenses and you adjust out the enrollment increase, it's about a 5%. That's basically what the expenses are trending at,
Right.
5 or 6%. So the plan would be align those revenue and expenses one time, and then from there, medical CPI we found is 3.7%. So hopefully the plan could manage to a little bit lower than what Millman's projecting with the 6 and the 8%. But in this scenario, we said 5% to kind of mimic what the future expenses are. So then, once you get it aligned, you got your expenses going at the same rate as your revenue, and then you're in good shape.
Follow up? So why wouldn't we actually have a formula that would take that rate of increase and tie it directly to the expenses?
Because
some.
Yeah, well, you're not sure. It's too late because you don't know what your expenses are going to be. So you have to determine your revenue in advance, right?
Right.
And then the expense, it's not a fully insured product, so you don't know how the claims are going to come in. You could have, so in theory, that's what you're trying to target, but you're going to be off. You're going to have a gain or you're going to have a loss. And that's part of what we're recommending with this 14% target. So you're trying to aim for 14, you have a good year, well, now you're at 15%, or you have a bad year, you're at 13%, and then you adjust each year going forward. So you may need a little bit more revenue to offset that gain or that loss. But you don't know, you can't peg that expense perfectly. So it's hard to just use a formula to solve for what the revenue needs to be. You're projecting what the revenue should be, and then there's going to be some kind of gain loss that you're going to true up in the out years.
One more follow-up, and then I'll be quiet. Sorry about that. But it seems to me like if you project, let's say, your $65 million surplus, all right, so you say, okay, we're going to try to make sure that we do these adjustments to the next year, and you basically use the $65 million. So some year, like you said, one year is 12%, the next year is 14%. I'm just going to throw some numbers here. All right, so you're 14%, but always try to set it up to where, okay, now we can absorb that increase in the surplus. The surplus would cover that. But then the next year, we'd make an adjustment based upon the previous year's expenses, and we would get our surplus back at some point and go on down the street a little bit. It seems like it'd just be easier to kind of make this thing glide more than dropping up.
I think they wanted this a little more formal because in the past, it would be common sense to do it that way, but I think that there was nothing formal in place and nothing got done. So there was a law or a bill or an act that was put in place where we tried our best to say, right now in this bill, what is that percentage going to be? Well, we don't know because the claims are going to fluctuate. So the best we came up with is tying it to medical CPI, which should be a long-term percentage that you can increase your revenue at and kind of hit those expenses.
Thank you.
Senator Hammer.
Thank you. Go back to the slide 6 on page 3, and it has the breakout of the expenses, if I'm interpreting this right. You got 5 primary contributors: the medical claims, RX administration, plan administration, and the MAPD. Is that right? Those are the main contributors.
Yes.
I can't remember if you've handed out in the other meeting, but when it comes to the medical claims, when it comes to all of these, did you share or can you share how it is that you arrived at the projections that you did? For example, is it on the medical claims, for example, X percentage of your projection is based on the theory of the number of employees that are going to be added over the time? Or is it because based on history of the complicated procedures that have attributed to medical claims. Is all that proprietary, or is that something that you can share with us so we could see what it is that goes into these numbers?
Well, in the assumptions page, you can see what the trends that were used, and these come from Milliman's projections. So they're the actuary for the plan. So our job at Siegel is really to look at more of the revenue side. What we did on the expenses is we looked at Milliman's projections. We looked at the numbers and we said, okay, these are reasonable. The trends that they use are in line with what we would use. So I hope that helps answer the question.
It does. You're making your projections on the basis of the information that Milliman's providing to you, so we need to go to Milliman to get the data.
On the expense side, and then we're playing with different levers on the revenue side to address the funding. So it's really more revenue and funding and reserve focused than the actual expenses.
All right, Grant, is that something that's been shared in the other meetings I'm just forgetting, or is that something that we can get access to?
I can get you some more detailed information on what they're looking at, but from a general kind of 100,000-foot answer to your question, it really is experience which is driving those numbers. They're looking at the past year, 18 months of what the plan has experienced and then projecting future expenses off of that number. So it's something that's constantly being evaluated and rolled out and getting adjusted upwards or downwards based upon what experience the plan is going through.
And last question, Mr. Chair. In those projections, I'm trying to remember, do we factor anything in there for behavior modification, new drugs coming on the scene, that are supposed to help with different lifestyles? The things that are, we've got that broke out somewhere, don't we, that shows, or do we not?
Actually, I don't think we do at this point because the wellness program has been stopped. There's really not any behavioral modification or any kind of program in place at this point that really is getting to what you're trying to get to of, are we spending $1 on prevention to avoid $10 on the cure? We're not really seeing that right now.
All right, thank you. Thank you, Mr. Chair.
Yes. Representative Long, you're recognized.
Thank you, Mr. Chair. You may have mentioned it earlier and I missed it, but do the teachers have basically the same type of program like the other state employees as far as kind of a gold plan, silver, and bronze, where you have the bronze being health savings accounts?
Yes, they're afforded the same plan and the same plan design as state employees. The only difference is just what their premium share and how that divides out between the two plans. But they do have the same plans that are offered to state employees.
Follow up?
Go ahead.
Any idea what the breakdown is as far as how many teachers are in the gold plan versus the bronze? And if you didn't know it, could you get it for us?
If you can give me just a minute, I can get some of those latest numbers.
Thank you, sir. Appreciate it. Thank you, Mr. Chairman.
Representative Vaught, you're recognized.
Thank you. I think my question's for Mr. Grant also. I kind of want to go back to what Senator Hammer kind of was on about the prevention or the wellness numbers. And what do y'all decide, how do y'all decide what you're going to cover for wellness and what you're not going to cover for wellness? So I'll use an example, okay? So my example is we'll pay for a surgery, a weight loss surgery, but we won't pay for the shot that helps keep the weight off of them so that they don't have to go get the surgery or continue to help them to lose that weight. Because that would be a wellness something in my book versus something drastic as in having the major surgery done. What constitutes what we're going to cover, what we're not going to cover? What is wellness? Why are we not working toward more wellness and less away from what I would consider to be way more expensive procedures in the end?
Right, and I think you kind of are asking the million-dollar question, and it's something that we're constantly challenged with, and we're challenging our vendors, our third-party administrator, and our pharmacy benefit manager to do those things, which is come to the table, give us recommendations on what's the latest and greatest. Now, the challenge that they have is advising us around what is the best use of that dollar, what has the most study around it that would produce the longest lasting result, and those things. On the weight loss example that you're given, I I mean, we're in the midst of studying that and really trying to figure out the efficacy of those medications and the long-term impact. Is it really in the best interest of the plan to pay for those 1 year or for 18 months or whatnot and get the savings for 5 years down the road? Obviously, there's a lot of study, there's a lot of work that's been done on the bypass and the bariatric procedures, and we kind of have some predictability. We kind of know what those things are. So that's why it is the more safe and acceptable for the plan management and the fiduciary responsibility to go down that path while we still study the weight loss medications and those things. And we're doing that across the board, whether it's a cancer treatment, cardiovascular disease prevention, all of those things. I am constantly asking for new and updated information, and it is part of we have a summary plan document which outlines essentially what the plan is going to cover and not cover. We evaluate that on an annual basis. We're looking at it quarterly now to see if there's any kind of interim updates that we need to be making. But annually, we're looking at it holistically, top to bottom, to see if it's doing the best and really what we want to go through. But all of those challenges are playing in when it comes to making decisions on whether we cover anything that you've brought up. And the latest and greatest, do we go with the fad or do we go with what's proven and known?
So kind of a quick follow-up. So the reason I know that was a long way to get to where I was trying to get to, but would that not affect the bottom dollar? If we choose something that is maybe a more wellness route versus something that is more of a surgical need, would that not essentially affect what we've got here on paper for expenses?
Absolutely, especially those off years. As we look to figure out ways to contain and control those medical claim expenses, it really is, as I said a minute ago, we need to figure out ways to get to, and this is a healthcare industry debate that's going on, of figuring out how to invest $1 in prevention to avoid $10 on the cure. And it's something that we just constantly have to look at, and we have to challenge the industry to do the same. Right now, it's not set up to do that. I think we've all experienced it's a lot easier to get the surgery than it is the preventative measure. And we as a body, you as a legislative body, continuously, I would suggest pushing that envelope and getting us to the point that we're really talking more about how do we use healthcare to prevent disease rather than cure disease.
Thank you. Thank you, Mr. Chair.
Members, any additional questions for either of these gentlemen? Seeing none, thank you.
I do have the answer to the breakdown.
Okay. Yep, great. For Representative Long's question?
Yes.
Great.
If you're looking at PSC General, and this is belly button, so this is the employee, spouse, dependents. You're looking at a total of 104,690 participants, majority of which 52,300 some odd are in your classic plan. 20,000 some odd are in your premium plan, and 9,700 are in the basic plan. So that roughly gives you kind of the breakdown. Majority on the public school side do go to the classic plan. That is your high deductible plan that you were able to balance with an HSA on those costs.
Representative Long, that gets your question answered, okay? Mr. Wallace, do you have anything additional that you want to add to the committee today?
Well, and thank you. The only thing I would just kind of add are a couple of things. I do want to learn from history and provide a cautionary tale of doing nothing really kind of got us to the point of where we're at right now. I would also caution conversations that we're having today and things that we do today. We might not necessarily be here in 5 years to be able to remember these conversations and remind other people of these conversations. And this is a very complex model because you've got 200 some odd school districts that all do their financing and their accounting differently than one another. So you're trying to balance the pressures on that end. You're trying to make sure that the Department of Education is not overburdened, and you're not trying to overburden our members as well. So what my goals have really been able to make sure that we're getting parity between all of those entities as well as public school and state employees. That is one complaint that I hear a lot, is that there isn't that parity that people think there should be between those two plans. And making sure that it's predictable. One thing that we have not had is really, and Patrick spoke to it, of that predictability to where when we come to the legislature, we know that those increases are going to be tagged at a 6%, an 8%, whatever number we find out to be that magic number, to where when you're sitting here and doing the 2-year budget cycles, you're not getting behind the 8 ball, and that you really can find some measured, known number that we're all working towards and doesn't come as a shock or surprise to the legislature, nor the districts, nor the members. This is one thing to kind of educate and just fill you in. We review rates annually, and we're in the second year of a 5-year plan to really get a 75-25 cost share. That was what was really shown to be the competitive rate in our comparable states. So we're working on that. That does mean that we have to bring down that member share a little bit in order to make sure that they're getting that 25%. And then it's trying to figure out that increase on the state side and the district side to get to that 75%. Once we hit year 5 in our model, we have pegged a 6% growth to that, so that 6% is shared across all of those funding participants, and it's known as we move forward. So we are on somewhat of a path that achieves kind of what Patrick was getting to. And just again, we have a lot of unknowns. The curing, or kind of the roll-off of medical claims, is about 180 days behind when that claim is incurred. So to Patrick's point, we're about midway through a new year or starting a new fiscal year by the time we figure out what the ending balance is on what we did the previous year. So we're always in this game of catching up. It really is challenging to try to get ahead of the curve. But with that, I would answer any additional questions. Thank you all for allowing me to come and be part of the conversation, and I look forward to working with you all in the future as we navigate this challenge and this opportunity.
Gentlemen, thank you very much for your presentation today. Members, if you'll go to item D in your packet, especially Exhibit D, which is the final adequacy recommendation for the 94th General Assembly. By statute, if this body of the adequacy study by joint education chooses to amend any portion of this, then we have to state by vote prior to March 1st that we are going to amend anything that's in here. And so I think it's prudent that as we look and study this and the presentation that's been given today, that we be prepared in the event we were to make a change to the PSE plan, then we would already have that documentation in place. Does that make sense? So without objection, I would make this motion and obviously be open for discussion. That pursuant to Arkansas Code 10.3.2104, specifically subsections D, 3, and B, I move to amend the adequacy recommendation by submitting in writing to the President Pro Tem of the Senate and the Speaker of the House documentation of the information presented to the Education Committee today, and statement that the committees will continue to study the issue of revision of the matrix funding amounts for health insurance for all public school employees. This does not say that we're changing anything, but just satisfying statute that in the event as we continue to study this, we would satisfy that March 1 deadline. So a motion is on the floor. Do I have a second? I have a second by Senator Bryan. Any discussion on the motion? Representative McKenzie, you're recognized.
Thank you. Thank you, Mr. Chair. So we would have to make any of those strategic recommendations prior to March 1st?
No, we would have to have this motion in place and documented to the President of the Senate and the Speaker of the House prior to March 1st. Yeah. Any other discussion or questions on the motion? Seeing none, all those in favor say aye. Aye. Opposed, nay. The ayes have it. We'll have staff note that motion. We'll go now to item E. Ms. Julie, if you'll identify yourself for the record and then begin your presentation.
Good morning, and thank you. I'm Julie Holt with the Bureau, and we're going to pivot back to the 2024 adequacy study. All of this is pertinent to adequacy, but we're going back to looking forward to what you're going to do in the next biennium. So where we are, you may remember in January, we gave you kind of the background. We talked about those achievement scores and where we were looking on those. We think of them as outcome measures. Yesterday, Lori presented all about facility spending. That's important to consider that as a whole because it's definitely the responsibility of this committee and is part of adequacy, yet it's a very different funding model than what we do with adequacy. So today what I want to do is just provide a really big picture view of how funding for adequacy works in Arkansas. In March, we'll get into what we call our resource allocation reports, and we'll take a much more fine-grained look at funding versus spending for all the various items that are in the matrix, plus how categorical and supplemental funds are spent. But today we're really going to do the big picture so we can see how it all fits together. So these are the topics we'll go through today. Usually we like to start out presenting what's happening here in Arkansas. I'm going to start with the national scope, just the flow seemed to make more sense for this presentation. But then we'll take a look at Arkansas's funding model, and then we'll consider some of the things that happened in 2023 in the General Assembly's actions and how those could affect adequacy in the future. So when we get to the national picture, Elizabeth talked to you about this when she gave the history report, but you may remember from that in the early 1900s up to about 1970, education was really a local responsibility. So local governments funded their public schools. Starting in 1970, there was a series of lawsuits in states across the country that had to do with the fact that while education is not a provision in the federal constitution, most state constitutions, including Arkansas, have a provision to provide public education to their students. So what happened in these lawsuits is that courts, by and large, said, state, actually, this isn't a local responsibility, but it falls to you because you've got it in your constitution. So that's what happened here in the 1980s with Alma v. Dupree, and that's where the court said, schools are not being funded equitably. It's very different in richer communities versus not as rich communities. And then again in 2002 with Lakeview, when it also, in addition to equity, said that adequacy was not being reached. So as a result of all those lawsuits, public education really became recognized as a state responsibility. And so you saw a shift in the funding. Up until about the 1970s, local governments assumed about 80% of the funding for their public schools. Since all of these lawsuits have taken place, you see a more equal balance between what local governments and state governments provide. And then because of some federal programs such as the Elementary, Secondary Education Act of 1965, which was later revoted as No Child Left Behind, and now it's Every Student Succeeds Act. And then IDEA, which came in the 1970s to address special education students, and some other programs. Federal government traditionally has donated about 10% of funding. You're going to see when I show you some numbers later on, that's been higher in recent years, and that's that additional COVID money that's come in. So if you think about it nationally, about 1 out of every 5 public dollars is spent on K-12 public education systems. And if you look in Arkansas, and this is the most recent data from the census, the 21% of the state budget was allocated to K-12 education, so just a little bit higher than that 1 of 5. And you can see that welfare programs got the largest percentage and police programs got the smallest. when you look at it that way, you can make comparisons among the states. This is often referred to as effort. And you can see in terms of effort, we tied with Minnesota for 21st place with that 21% of our budget going to education. The lowest state in those terms was Hawaii. 14% of their budget is allocated to education, and New Jersey had the highest with 30.5%. Some researchers prefer or opt to talk about and make these comparisons looking at per student revenue. And if you look at the most recent data from NCES on state level revenues for education, and then we adjusted these for cost of living differences among the states, Arkansas had about $13,000 per student in revenues. And when you compare with the states, we're 40th, which puts us in the second quintile. So the highest state, even after those COLA adjustments were made, was New York with $23,509, and the lowest per student revenue was Idaho with $93.37. So after all these lawsuits started saying, okay, states, yes, you're responsible, the National Conference of State Legislators came out with a guide in '96 to help states structure their funding systems for public education. And they really listed 5 different goals that, goals that states needed to consider. The first being equity. And this is not only in terms of equity for students, so making sure they're on level playing fields and have equal access to education resources, but also equity for taxpayers, so that you didn't have one group or one locale of taxpayers paying a much heavier burden than elsewhere. Next, they talked about efficiency, and this efficiency is, of course, making the best use of resources, but also talking about state oversight not being so complicated that it was really expensive to develop a system to oversee it, and then also not making it such a burden for schools to comply. So a system that was fairly transparent and worked efficiently as well. And of course, adequacy, we all know, is providing those resources so that students can meet those levels of learning that states and schools want them to meet. Accountability, again, that's just transparency and accountability both at the state level and the school level. And then finally, stability. And that's so that taxpayers in the state know from year to year or have a very good idea of what that burden is going to be, what the costs are going to be, and then also so schools know from year to year and can make planning decisions because they have a pretty good idea of what their budget is going to be. NCSL is actually in the process of updating this document for the first time, and that should come out this summer, so I didn't have access to their latest guidance. The Learning Policy Institute came out 10 years after that with also some goals for a funding system, and theirs really focused on things they thought states should consider including in their funding systems. So one is that early learning environment, and while that's not part of adequacy, we do have state support for early learning, and of course in the LEARNS Act, it was definitely paid attention to there as well. Then they called for equitably funded schools and high-quality teaching. They wanted teachers to be both well-prepared, so those good preparation systems, and also supported throughout their careers, up-to-date curriculums, and then well-organized schools. So those are kind of descriptive of what funding systems should be. There are some researchers, Education Week used to do this, that tried to make assessments of funding system, of states' education funding systems. The Albert Shanker Institute released a paper in 2023 that did this. They looked at whether the effort in a state, the adequacy, if a state was reaching adequacy, and equity. And by their metrics, they found Arkansas to be a high effort, and the way they judged that was using the percentage of state budget that's allocated, so what we looked at earlier. And they said, yes, Arkansas does a really good job and makes a high effort compared to other states. They have their own index that is not real, it's pretty obscure and pretty complicated, but it's basically, I think, a regression system that looks at how much would you have to spend to get students to this an average score, I'm assuming on the NAEP because that's the only national test. And they found that Arkansas's per student spending is below that in most of our districts. And then in equity, they found that we're low equity because they say our high poverty districts are spending less per pupil than our more affluent districts. So these are their findings. You'll see next month when we show differences between schools, our picture of equity that we're finding is different from this. We find that our schools with high populations of free and reduced lunch students are actually spending more in most cases. So I did want to present this because it's recent research, but let you know that we've found some disparities with this. So when states are trying to figure out their funding models, they have to figure out, what makes adequacy. And so there have been 4 different means of determining adequacy that states have used over the years. First and most common is an evidence-based approach. That's what we do. That's what Auden and Pica started us with in 2003. And as the Bureau, we continue to do as we do these biennial studies. We look at what the research says. We look at what's happening in terms of Arkansas evidence, and we present that to you, and you make your decisions based on evidence of what leads to higher levels of student achievement and how much does that cost. A second way that states also use is professional judgment, and that simply means they bring in panels of educators whenever they do their adequacy study, and they let these educators say, this is what's needed for an adequate education, and this is how much it costs. And Auden and Pica actually did this back in 2003 as a supplement to their education or their evidence-based approach. We do not bring in panels, but as you know, we do send out surveys each year and get input from our educators. So we have something of an element of this with ours. A third method is successful schools, and you may remember hearing Augenblick, Palek, and Associates talk about this in 2020 when they presented to you. And it's also the basis for our BLR cohort of schools. And successful schools are that's found, again, using a regression model where you're basically controlling for the inputs or the demographics of your student body and predicting test scores and comparing those to actual test scores. And those schools that have actual test scores that are higher than predicted, the assumption is that there's something going on in those schools. And so you want to look at those schools to see what they're doing to get their students to those higher than expected levels of learning. And then those schools are used to set funding decisions. The fourth model is rarely used. It was developed probably about 10 years ago at Texas A&M. It's called a cost function. It's also based on a multiple regression model where you just throw in all these things and see how much it's going to cost to get to a goal that has been set by the state. So we want 90% of our kids to score proficient. We'll do a regression model and make a determination or an estimate of how much per student we're going to have to pay to get to that level of learning. So those are the 4 ways that states have used. And again, we use evidence-based. Then there are also, once you've made that decision and you know how much it's going to cost, you've got to figure out how you're going to get the money out to the school districts. So there are 4 main ways to do that, traditionally have done that. There's per pupil or foundation funding. That, of course, is what we do. We determine with the use of our matrix, which I'll show you in just a minute, what that foundation funding amount is going to be that goes out per pupil. Oftentimes that's supplemented with categorical or weighted funding to help address those needs of either special populations of students or very small and remote school districts. 34 states, according to Education Commission of the States, use this model. There's also a resource allocation model that about 10 states have used, and this funds based on the resources that are needed. So instead of sending money out per pupil, you look and say, okay, you've got 50 first graders and you want 20 in a class, so you're going to need 3 first grade teachers. We're going to fund 3 first grade teachers. So that's what the resource allocation model does. So 5 states use a hybrid of that. North Carolina is one that's done this. They fund their staffing based on the resource allocation method, but then when they get to things like textbooks and technology, they fund that on a per pupil basis. And then 2 states where use a guaranteed tax-based model, and this is where in states where local governments still have a larger responsibility financially for their school districts. But the state looks and says, okay, we know you've got to have a tax base of this much to be able to fund your students at an adequate amount. So if the local government can't fund it, the state will fill in those holes. We do this to a point with our state foundation funding aid, and I'll explain that more detail in just a minute. But it's really also looking at what districts can't pay all the foundation funding aid that's needed. We supply those state funds. And then there's some new approaches altogether, and you heard from ECS last fall and Representative Cozart talking about Tennessee's model. And it's called a strategic student-based model, and it is per pupil in some sense, but they've designed their model because they've set specific goals they want to reach, and then they've designed their funding model to make sure that they're both incentivizing and rewarding so that schools will reach those goals. And Representative Cozart can tell you more about that if you would like. So what do we do in Arkansas? Well, as I said, we do the evidence-based study, which we're in the middle of right now, and we do the foundation-based funding approach. So at first we have to gather the revenues, and that's done through taxes, and we've got a number of funds that go or collect all the money that's then distributed to the public schools. And these are either from off the top from the general revenues, or they're dedicated taxes, such as with the Educational Adequacy Fund. There's also a fund that funds the Department of Education, and then there's the funding that Lori talked to you yesterday about, the facilities funding. These are what has been in each of these funds over the last 5 years. These amounts are what's available for public schools. It's not necessarily what's been appropriated or spent. If you look at the totals of all those funds over the last 5 years, you can see how they have increased. And then to get that money out, we have, as we said, the foundation model, and that's how the bulk of the money is sent out to schools. But we also provide categorical funds, and then over the years, we've added a number of supplemental funds. So with your foundation fund, that's set by the matrix. That's what lists all the resources that we say are needed for adequacy and how much those resources cost. However, this money, once it hits the school districts, they're not restricted to spend it on those uses. So we consider it unrestricted funds. And that's why you always hear that it's a funding model and not a spending model. The categorical funds are mostly designed for equity. So they go out to help fund the additional resources that may be needed to help certain students overcome learning barriers. That money is restricted to one of those uses. And then there's supplemental funds. These are funds that are generally helping with adequacy purposes where the matrix sometimes is falling short for specific schools, and it's a mix of restricted and unrestricted. So when you look at all of the revenues together, or all of the funding sources together that schools receive, this pie kind of shows you how it all fits together. So you can see where foundation funding does make up the bulk of the funds that schools have. However, you need to remember some of that's the state foundation funding aid, and some of that's money that is collected through the uniform rate of tax, which is those first 25 mills that are collected through property tax. So that's a split of those funds. The next highest in 2022, you can see were those federal funds. Like I said, usually before COVID, that's usually around 10%. I think it will settle back down to 10% as all of those ARPA and ESSER funds work their way out of the system. But in 2022, the federal funding did make up a lot of the funding for schools. After that are your other local and state funds. There are some state dollars that flow outside of these three funding sources to schools for particular needs. And then there's also local money. Districts that have over the 25 mills get to keep those funds, and a lot of times those are dedicated for facilities, but that makes up some of that other local money. The categorical funds make up about 4% of what schools receive, and those supplemental funds make up almost 2%. So foundation funding, just to focus on it a little bit real quickly. In 2023, the matrix provided $7,413 per student. And when I say per student, that's really an average daily membership number that the schools provide. And for districts, that's the average daily membership for the first 3 quarters of the year of the prior year. And that's the case with most charters, but if it's a new charter, if the charter's added a grade, or if they've increased the enrollment cap, you're going to get a mix of prior and current year funding for charters. And that figure is derived through this matrix, and this is what you'll be working on in the next few months are these the items we want in the matrix? And as Taylor told you, this matrix is not in statute. It's your tool. So it's really one you can manipulate as you want. But once you get the items and make sure that's what you want in the matrix and believes necessary for adequacy, then you apply that per pupil cost to that, add all that up, and that's your foundation funding number. Again, funding, not a spending model. So I talked about that split in foundation funding, and this in 2023 shows you how that split was. So if you look at districts, that uniform rate of tax collected $1.35 billion. So that's money that came from the counties to the state and then went right back out to the school districts. Then that equaled or supplied about 38% of what the school districts needed to provide that 7813 for all their students. So state foundation funding aid comes in and helps make up the difference for that. In 23, it made up about 61%. There are 2 other smaller sources of funds. The 98% adjustment is simply, the assumption is that counties are going to collect 98% of their property tax. If they don't, the state will help fill in those holes. And then miscellaneous funds are funds from grazing rights or railroads, so lands where you're not collecting property tax, but you're collecting other types of monies. So you can see for districts, the split, and then over in charters, because they do not have a land base and property tax to support them, state foundation funding aid supplies all of their funding, which was $184 million in 2023. So you can see over the last 5 years how the foundation funding amount has climbed. If you control for inflation, however, that $6,700 in 2019, if those were 2023 dollars, it would be $8,046. So it may not feel like we've kept up with inflation. We do ask superintendents some things about foundation funding and the matrix. We ask them how or to what extent do they use the matrix to guide their spending decisions? And we had 69% of our superintendents say that they either moderately or extensively use the matrix to help guide their spending. And then we asked the same thing for staffing, and we had 71% of our superintendents who said they did that. There are a couple of things we want to tell you that are kind of issues with the matrix that we've run into or that have been raised. This first one is one that we've run into, and that's preschools. This is an outside because these numbers are wrong. When I first started here, we had 7 standalone preschools. And when you have the standalone preschools, we can trace all the funding and spending down to the preschool level, and we can exclude that from our adequacy. Now, this year, we have not 1, but 13 standalone schools, and we have 102 preschools that are embedded with other schools. So one of the issues is that up until this current school year, so not the year where we've done our study, there was no ADM counted for preschools. So we can't come up with per pupil cost for those standalone preschools. And then when the preschools are embedded with schools that have higher grades, we can't really tease out that spending very well. So it muddies our analysis just a little bit. We have done, I did look at the spending for those 13 standalone preschools. It was $35 million. Only $2 million of that was from foundation funding. So we think we're still hitting it pretty close, but we just want to be transparent that preschools are becoming more of a mix with school districts than they had been historically. Also, and this is an issue that we've had legislators raise over the years and also school districts, is just some disconnects between our funding matrix and reality. So as Elizabeth told you, our funding matrix is based on a school of 500. And when Auden and Pikus brought that to the legislature in 2003, that was because research showed that a school could most efficiently supply all the resources that were needed for adequacy with 500 kids. And so you may remember that's when the whole consolidation conversation was really strong in Arkansas. The legislature, though, looked at our situation and said, well, we don't have schools that big, so we're going to change it to a per pupil model, but they left it at that 500 level. So today, when you look at us, 80% of our schools are below 500. So when you try to apply that funding model to the school level, that is a disconnect there. On the district level, we have 19% of our schools that are less than 500. So it works for 80% of the school districts. And then there's just the math that's in the matrix itself. And what this chart shows you is what is in the matrix. The matrix, again, is funded for one school, K through 12, and assumes that there's 8% or 40 kids are in kindergarten, 115 are in grades 1 through 3, and the remaining 345 are in those higher grades. So this is the number of teachers that are funded for each of those grade levels. Yet if you divide those students out by what's in the adequacy or accreditation standards of what can be in each class, you can see we're not funding all of the teachers that are needed. So where the matrix funds 20.9 grade level or core teachers, in reality, schools or school districts could need up to 26 for those grades. So those are just some things to keep in mind as you think about the matrix. So we're going to move on to categorical funding. This is funding in addition to the matrix. This is all from state funds. And there are 4 kinds of categoricals. You heard all about ALE yesterday and heard that's funded on a full-time student equivalent basis at about $5,000, just under $5,000 per student in 23. There's a categorical fund for English language learners. So for every student who qualifies as someone who needs additional instruction to gain English proficiency, there's $366 that's sent to the schools. ESA is based on free and reduced lunch students, and it's given at tiered rates based on the concentration of free and reduced lunch students in a school. And then there's professional development that goes out on the per ADM basis, like foundation funding does, but it's restricted, and that's why it's considered a categorical. And so it's restricted for that use of professional development. Professional development, I said, is restricted to one of those uses. So they can transfer money from one categorical fund to another. So this chart shows you what they started out with in the blue bar, and then what those funds looked like after the transfers were made. So you can see that mostly it's in the ESA funds that are transferred into one of the other categorical fund pots. There are also supplemental funds. Isolated funding actually predated Lakeview, and that's money that's given out for school districts that are either very small or in very remote locations, and so face additional operational needs because of that. Then growth funding and declining enrollment funding were added at the time of Lakeview, and these are to help schools that either have growing enrollments or that are losing students, and so we're going to see a decline in the revenues they receive through the matrix. And then over the years, we've added enhanced transportation. This is money that's targeted to school districts where what's provided in the matrix for transportation just doesn't meet all their needs. Then there's special education high-cost occurrences. This was $14 million in '23. It was paid back to schools on a reimbursement basis to help with those students whose education needs are particularly expensive due to their special education needs. The Enhanced Student Achievement Grants, it's $5.3 million that was added is also reimburse schools for money they spend on what we think of as the three original uses or research-based purposes that research has shown helps students in poverty, such as tutoring before and after school and pre-K. Teacher salary equalization funds started out as money when the minimum salary increased to $36,000 several years ago. The money was given to schools that were already at the minimum but couldn't afford to increase it. And then over the years, that's sort of morphed into the Teacher Salary Equalization Fund, which is you set, during the adequacy study, a target average teacher salary, and then this money is dispersed through a formula to schools that are under that average teacher salary. And then finally, there's the additional professional development money, and that goes to a vendor to help with professional learning communities in the schools. So all of these funds, I'm talking at a very high level, and you probably have some specific questions. We're going to really get into the nitty-gritty of these in March and then probably again in May. So some of your questions may be answered when we get to those reports. I did want to mention some of the funding that came through the Lawrence Act. This, again, was not part of 2023, so we can't analyze any expenditures. But this is additional money that right now is funded outside of adequacy. So the legislature could decide to combine this with adequacy or to continue to treat it as separate funding or to create something all new together. So I did just want to go over what some of this money is. These are the line by line. This comes from the fiscal analysis that was supplied by ADE. So most of these are assumptions that are either from that document or that we've gleaned from the actual legislation that was written. And I won't read through all of these lines, but I do have a summary. So about $193 million from LEARNS will go to the schools to help support teachers either through salaries, maternity leave, or merit pay. Then there's $8.5 million that's going to go to providers for students who need tutoring. then there's 20 million that also it will go to the schools to help pay for tutors. And then there's 13.1 that will go to higher education to help with those teacher preparation or continuing education programs. And then also in 2023, in terms of funding, Act 630 provides some money to school districts for homeschool students who come to take part in extracurriculars. And then Act 74 set the foundation and categorical funding amounts for the next biennium. And that brings me to the end. As I said, next we will move into resource allocation reports, where you'll see lots and lots of data and charts, but hopefully we'll have it all arranged where it makes sense and we can get through it in a way that is helpful for everybody. And I'll be glad to take any questions.
Great. Thank you, Julie. Senator Hammer, you're recognized.
Thank you, and thanks for the great report and the great presentation. On page 3, on graph number 6, I'm sure it's out there somewhere, and if you could help find, I'd like to get it. Is there a correlation between the amount of money spent on education and the reduction of recipients of like Medicaid or reduction in incarceration? Rhode Island, you mentioned a while ago, they seem to have one of the higher amounts spent on education compared to what we're doing at like 20. So is there anything out there? Could you guys add that to your research list so we could?
I can look for that. I have not seen that specific. I've seen it with incomes, but I'm sure there's some research, so I will look for that.
Okay, can I get a couple more, Mr. Chairman, real quick?
Yeah, go ahead.
Thanks. On page 6, graph 12, is there any data that would show that if you're a hybrid, of which 5 states do, versus a per pupil or foundation funding, which 34 states do, that the hybrid produces a better educational outcome than the per pupil or foundational approach?
I have not seen that kind of analysis. This comes from ECS, and I know they've done descriptive. I don't know that they've analyzed that way, but I'll look for that and see. But I'm not aware of any.
Oh, if you don't mind, please, outcome results. And then on page 9, graph 3. The foundation, and this actually ties into page 11, graph 21. The foundation funding is what we send to the school, but we don't really have any control. That's the deal where we send it out the door. We give them a recommended model to go by, but at the end of the day, they make their choices, right?
Correct.
Okay, so you got that one, and then on page 11, you've got the foundation funding, and then you got the percentage, and then you got the survey on page 12 and 13 that shows 69 and 71%. What I'd be curious to know is there any way to track educational outcomes of the schools that do not follow the foundation funding recommendation versus those that do not? Or would there be any value in looking at that to see that the schools that follow the matrix get a better outcome than the ones that do not when it comes to critical education measurements?
Mm-hmm. We could definitely try to run some analyses with the data we have using the achievement data that Adrian presented. We'd want to control for some factors such as percent free and reduced lunch. That makes a big difference on outcomes, but we could take a stab at that for sure.
Okay, and then I'll just get offline, and the reason I'm asking that question is if you got what seems to be the majority that are following the foundation funding, but then you got some that are not, I think it would be of some value to know of those that are not. Who knows, maybe they're getting better educational outcomes by not following it versus those that are, because at the end of the day, we want better educational outcomes. But if we don't have that, I don't know how we would know that, which may help us make other decisions that we have to make.
Okay.
All right, thank you. Thank you, Mr. Chair.
Julie, back on page 3, graph 5, and you mentioned there were some discrepancies. I noticed in this pie chart, highlighted in orange, elementary and secondary education, so K-12 makes up 21%, higher education 11%. I was thinking from previous data that K-12 and higher ed in Arkansas is actually closer to 54%. When you mentioned discrepancy, was that BLR feels there's a discrepancy from the source provided?
Well, my discrepancies, I think I was talking about that Albert Shanker study. Yeah, this is from the census, so I can, yeah, let me look at that.
Okay, all right, thank you. Next, Representative McKenzie.
Thank you, Mr. Chair. I've just got a few points of clarity and then a question kind of stemming off of what Senator Hammer said. You said in between, I believe, slides 25 and 26, that there's $35 million available or that was funded in 2023 for preschools embedded within school districts, but only $2 million of that came directly from a FTE wash of some sort. I'm butchering that, but can you illuminate us to where the other $33 million has come from?
Yeah, I can. It's the $2 million was from their foundation funding.
Correct.
And or was from foundation funding. So even though they're standalones, they're part of a school district. And so the school district is, supplying their funding. And so the foundation funding that they receive for their ADM, that doesn't include preschool kids. Some of that's being spent at the preschool level. Most of that funding is coming from other state and local. So we know there's ABC money that they receive that wouldn't be considered foundation money. I believe that, some school districts are charging parents to bring their kids to the preschool if they don't qualify under one of the other programs. So that made up about $17 million of it, so about half of it. Federal funding was $9.5 million of it. And then categorical money funding was $5.8 million.
So what was the state and local share you mentioned at the very beginning?
The other state or local funding, so this is funding that's not foundation, it was $16.9 million.
It just seems, and again, this is an editorial coming out, it seems like a wide disparity of what we have allocated within their current funding and what somehow school districts are able to muster or pull from other resources, foundation or categorical, to make these work. And again, that's just more of a comment there. I have another question in regards to, follow-up.
Sure, go ahead.
In terms of, the matrix issues with the 500, as the baseline for our weights and measures. And you do a great job illuminating this in terms of the number of school districts, but if, what is the median or mean population size of school districts? Because we landed on 500 somehow, and obviously we have outliers at the high end of the scale. So do we have an idea of what the median mean or
I did that.
sizes?
I think I did that 2 years ago for that report, and I'd have to look at it again. I think our school districts were about 480, and our schools were definitely smaller than that. But I'd have to run that average. I can do that.
If you could provide that to me, that'd be great. And one last follow-up. In regards to the survey responses, so we've experienced some of these administrative, principal, and teacher survey responses before, and this is dovetailing off of what Senator Hammer has mentioned earlier. I appreciate this. It's a great signpost for us to understand if the FTEs work, and if what we're passing down is, if we have any type of target acquisition. If we don't get better qualitative information from superintendents and from administrators, not on an anecdotal basis, this is not helpful. And I don't mean that to be difficult or argumentative. It's just surveys and stimulus have a express purpose in the collection of information, specifically from clarified stakeholders. If we're just kind of asking one question without any of the dynamic response questions following it, or that information is not provided, we can't give an educated position on this adequacy process if we don't understand where those disconnects are.
Yeah, historically, when they first started sending out the survey to superintendents in the very beginning, the data systems were just being built and the data was not very reliable. And so the purpose of the survey was to collect all of that data. Now that we can pull so much from data from AppScan, we have moved away from asking superintendents to count their computers or count, all of the things that we can pull from the computer system. And we have tried to ask them more, what's your experience with this, or, what are your perceived needs with this, because that's something we can't get out of AppScan. We can definitely ask more questions if there are questions that these committees want. We're always glad to put those in the surveys. But that's just to provide a little historical of how those have kind of morphed.
Sorry to continue, but I'll be done. And I appreciate that. What is the feedback process? How do we, as members or individuals concerned about education, work with the department to help inform that? Because this is, it's vital. By the numbers here, we're failing 33% of some superintendents in their perception of what the FTEs are. So how do we get involved so that we can ask the right questions in a succinct and...
I think, however, the chairs would like you to do that.
I would think if there's specific questions that would be beneficial to the body, just submit those to staff, and we can, I know Emily will be happy to populate those together, send them over as a single document over to BLR, and we can get those added into.
Thank you, Chair.
Yep. Senator Davis, you're recognized.
Sorry, thank you,
Yes,
Mr.
ma'am.
Chair. I appreciate that. Is there anything that shows, so when you look at, Arkansas spending a little over $13,000 per student versus New York, who's spending, $23,000, is there any breakdown on what exactly that money's being spent on? I mean, like we talk about in Arkansas, it's a funding matrix, not a spending matrix, and so I'd just be curious, if New York, are they spending that, maybe because land is more expensive and building is more expensive? Is a lot of that money going towards facilities or, construction versus actually being spent on students or lower student-teacher ratios and, tutors or, reading specialists, whatever in the classroom that actually directly benefits students? Do you know if there's any breakdown on that across the states?
I don't know of anything that kind of holistically, but as we go through our individual items of what we're spending on, NCES on some of those does have that comparison that we can do state by state. And then, of course, with teacher salaries, we can do it. So when we get to those reports, you will see more of those breakdowns.
Okay.
You're welcome.
Representative Beck, you're recognized for a question.
Thank you, Mr. Chair. And I'm going to maybe ask the question just a little bit different. In terms of the average school size or the ideal school of 500, so do you have the number of students, the percentage of students in Arkansas that are attending schools that are 500 and more versus those that are 500 and less?
The percentage of schools that they're sending.
Not the percentage of schools, the percentage of students
that are in those
that are in schools that are 500 and more versus 500 and less.
I can calculate that. I'll have to calculate that for you.
Senator Hammer, you're recognized for a question.
Thank you, Mr. Chair. Back on page 5, if I'm interpreting graph 10 right, we're pretty good on the high effort, but then the other two categories not so good. Is that correct?
According to their metrics.
Right. So did they provide in their metrics for simplicity like a checkoff list of these are the areas where you are low adequacy and low equity, and this is what you can do or what you should be working on doing in order to get it up to a higher effort level?
Not simple. The formula for the adequacy is they've looked at a national average score that if you wanted to get all students to this that was proficient, how much are states spending or how much is being spent to get those students to that? And that's where they found, I think 75% of the districts in Arkansas were not spending at that level. And then the equity, again, is looking at low-income districts versus more affluent districts and what they're spending per student. So, and like I said, on the adequacy, on the equity, we're showing something different than what they're finding. And we'll be showing that to you in March and May, that you'll see that it looks like our schools that have higher percentages of free and reduced lunch, because they do receive extra dollars, are able to spend more per student. So our finding doesn't show this. Education Week, up until COVID, used to do their own take on this, and they also gave us fairly good grades in equity and not inadequacy. What the Albert Shanker Institute basically said is Arkansas is making a really good effort, but because it is a smaller state and a more rural state, that it's just really difficult to meet the challenges of funding students at appropriate levels. And we were talking about this in our group yesterday, or my team, is it's kind of like we give isolated schools more money because they can't operate as efficiently. So in their paper, they're kind of arguing that the federal government might help states that are more rural and that are smaller because of the same things. They're just not the efficiencies that states like New York or Massachusetts can reach. So and I'm not arguing that, but it was just an interesting concept that we were saying yesterday. We hadn't really thought about it from that perspective. So I think that's what they had come to the results after looking at all the states and what was happening in the states.
So is there any connection then between schools that receive higher funding for free and reduced lunch, and are they actually producing better outcomes because they're getting more money, but how do we know that that money is actually translating into better results?
Yeah, Elizabeth will probably talk more about this, but I know I gave this report last year, and in looking at the research said basically if you provided a weight of about 0.2 above foundation funding for those free and reduced lunch students and spent it on smaller classrooms and high-quality teachers, you did see results that could help them get to levels of achievement that were like their counterparts.
All right. Ms. Chair, can we get a copy of that you presented? So if you don't mind, I'd like to get a copy of that you just referenced that you presented last year.
Okay, of last year's study?
Well, or that specific point that shows on the free and reduced lunch.
Okay. I'll find those. Yeah, I'll have to go back and find those research papers. But yes.
All right. Mr. Chair, can I have one last quick one?
Yes, go ahead.
Thanks. Appreciate the latitude. So back on the foundation funding, how do you tie what schools get for free and reduced lunch into the foundation funding and attach that to better outcomes educationally? Is there a common denominator thread that would bring those two things together? Because the free and reduced lunch money is not tied into the foundation funding.
Correct.
So is there a thread, especially, I guess, the schools that are not functioning by the foundation funding, are they any better, especially if they're getting the free and reduced lunch? That maybe I'm not articulating well where I'm trying to get to.
Yeah, I'll have to say I'm not. Could you repeat that, please?
Yeah, I'm just trying to make the connection that the schools that are not spending according to the foundation funding, and the ones that are not, are they receiving, how much are they receiving in free and reduced lunch money? And do they produce any better outcome? They're getting the money, but are they producing better outcomes because they're getting the foundation funding, but they're not spending it the way we think that they ought to be spending it? And how do we know that that money's actually getting spent wisely if they're not producing better outcomes? Is there any way to go about figuring that out?
I'm trying to think that we'd have to be really careful how we'll try to operationalize that, but we'll have to be really careful because there's so many variables that can go into a school's performance level or a student's performance level. But we've not looked at it down to that level with just those schools. And so you're talking about the schools where the superintendent says that they're using it as a guide, right?
I think I'm more focused on the ones that aren't. And then if they're getting all that free and reduced lunch money on top of that, but they're not producing any better outcomes, I got to wonder, well, how's all that money you're getting actually producing a better outcome? You're not spending according to the foundation model. You're getting free and reduced lunch money, and it may not be all the 30%, that aren't following the foundation funding. And if they're getting all that money, but not producing better outcomes, but yet they want this equality thing, that's what kind of raises a flag to me. What are you doing with what you got? Before we talk about giving you more, especially if you got a high free and reduced lunch that you're getting a lot of money coming in. And we can talk offline.
Okay.
Thanks, Mr. Thanks for the chair. Thanks for latitude.
Yes, sir. Members, before I go to non-committee members, any follow-up questions from committee members? Seeing none, Representative Springer, you're recognized for a question.
Good morning. Thank you, Mr. Chair. Thank you, Ms. Holt. I totally enjoy the reports from you and your staff members. I really enjoy receiving that information, so thank you very much. My question is a follow-up to Senator Hammer's question, that slide 10 on page 5, where he asked the question about the equity and the findings that there was low equity in Arkansas. Are you all looking at specific, my question is, are you all looking at specific variables? And so what are the variables that you all look at to arrive at the difference between, do you know the variables that this study looked at compared to yours in order to come up with that? If you have that information and intend to provide later on, that would be good. But I'm just curious to know what those variables were in order for them to arrive at the conclusion that they did compared to what you arrived at. Mm-hmm. I think that would help us determine, the conclusions that have been reached. Do you agree?
Yes, and I'll try to get their more detailed explanation for each of these and send those.
All right, thank you very much.
Great. All right, members, thank you very much for your attention today. Ms. Julie, thank you so much for this very detailed report. Members, just make note, our next planned meeting of this joint committee will be on Monday, March the 11th at 10 a.m. That is planned. We're still working out a couple of details. The chairs feel the necessity to meet that day due to the fact that we will lose a month in April, at least April, with the fiscal session. And so we want to try to at least get one presentation in March, if at all possible. So that is planned. We're waiting on the details. Make a pencil mark on your calendar. We will firm that up hopefully by the end of this week and have that added to the schedule. Seeing no other business for the committee, we're adjourned.